Hello, this is Welcome to Medicare, provided by the Nebraska SHIP. Nebraska SHIP is a division of the Nebraska Department of Insurance and is a federally funded member of the National SHIP Network and the SMP Network. The SHIP Network, State Health Insurance Assistance Program, exists to provide unbiased Medicare education and counseling. Where our SMP side, the Senior Medicare Patrol of our office, that side exists to help educate individuals on the topic of Medicare fraud, error, and abuse. And we also serve as a location to report suspected fraud, error, or abuse. Now, the way we serve the state is through 7 locations provided in partnership with Area Agency on Aging offices, as well as the Volunteers Assisting Seniors location in Omaha. What we exist to provide again is that free, confidential, and unbiased education regarding the topic of Medicare and Medicare fraud prevention. When you reach out to our toll-free number, you'll be able to speak to the office location nearest you, and certainly the web address does provide some very good resources on our website. During Welcome to Medicare, we will touch on these topics: Medicare Part A and Part B, Medicare supplements, Medicare Part D, Medicare Advantage, also known as Medicare Part C, and Medicare fraud and abuse. Before we dig into the topics, let's quickly review some terms that you should keep in mind when you utilize your Medicare health insurance. The first term, of course, premium. Depending on decisions you make, you will potentially have a premium for each part of Medicare. That premium, of course, is a monthly payment that we pay in order to have insurance in place. Certainly, you will potentially encounter a deductible depending on the decisions you make. Certainly, a deductible is the amount that a person is responsible for before their insurance kicks in and starts paying its share of cost. Along the way to meet a deductible, or even after it's met, a person may encounter a copayment or a co-insurance. This is especially true for the use of Medicare prescription drug coverage. Copayments and co-insurance, the simple difference between the two: a copayment is typically a set dollar value, whereas a co-insurance is a set percentage of full cost. Now, the last term to keep in mind is an out-of-pocket maximum. Depending on decisions you make, you may or may not have an out-of-pocket maximum. Certainly, out-of-pocket maximum is referring to the amount, the total amount that an individual is responsible for. Once the out-of-pocket maximum has been reached, the responsibility then fully shifts over to the health insurance, where the policy would then cover at 100%. So very important terms to keep in mind when you do utilize your Medicare health insurance. Go on to the topic of Medicare itself. What is Medicare? To put it simply, Medicare is your federal health insurance, created in 1965, signed into law by President Lyndon Johnson. Initially, when Medicare was made available, it was only available to those folks who were age 65 years of age or older. It wasn't until 1972 that Medicare was expanded to include coverage for these other individuals younger than age 65, those individuals with a qualifying disability or end-stage renal disease. So basically, in order to qualify for Medicare benefits, a person simply needs to fit into one of these 3 categories. Now, once a person becomes Medicare eligible, they will need to determine how they want to receive their Medicare benefits. Generally, it's a decision between Original Medicare or Medicare Advantage. Now, both options have differences that need to be considered when making this decision, and we always encourage folks to remember Medicare is individual insurance. You really do want to approach this from an individual standpoint. As previously noted, we will begin with Original Medicare, Part A and Part B. Now, Medicare Part A serves as hospital insurance, paying for the 4 services listed on the slide. Part A covers inpatient hospital care, skilled nursing facility care, home health care, and hospice. Now, when we see skilled nursing, we always remind folks not to confuse that with a move into a nursing home. Medicare is insurance for short-term care. Medicare does not cover long-term care. So do not confuse the skilled nursing facility with a move into a nursing home. Rather, think of skilled nursing as a rehab stay. Maybe a person is receiving physical therapy, occupational therapy, or speech therapy. Now, beyond that, Medicare Part A is typically premium free. It's premium free because it's been paid for through 10 years of employment paying that Social Security Medicare tax. Now, if a person needs to use their Medicare Part A, there are deductibles and copays associated with its use. And certainly the usage and time that a person is using the benefits will determine the out-of-pocket cost. As we see on the slide, an inpatient hospital stay does have a deductible. This year is $1,632. The deductible paying for the first 60 days of hospitalization. Now, certainly if a person requires care beyond 60 days, they do have access up to 150 days in that inpatient setting. But we do see on the slide an indication that there is a daily copay for days 61 through 90, and that copay does increase for days 91 through 150. Now, beyond the inpatient hospitalization, as we noted, skilled nursing facility care is provided by Medicare Part A. And as we see on the slide, Medicare Part A does cover the first 20 days of skilled care fully, but a daily copay is imposed for those days 21 through 100. Now, Medicare Part B is medical insurance, basically paying for outpatient services that, of course, are medically necessary. So think of Medicare Part B as that part of Medicare that pays for the doctor visit or the specialist. If an individual requires labs or x-rays, outpatient services definitely can include other things such as durable medical equipment or preventative services. So basically, Medicare Part B is in place to pay for everything else outpatient. Regarding the cost of Medicare Part B does have a standard premium. That premium this year is $174.70 per month. Now, those individuals with a higher income, those individuals may see an IRMA, IRMA standing for Income Related Monthly Adjustment Amount. Now, an IRMA is essentially imposed when an individual has higher income, but very specifically what's being looked at is the income from 2 years previous. So this year in 2024, Social Security Medicare is looking at the 2022 tax return to determine if an individual owes an IRMA or not. Now, if a person does owe an IRMA, they will receive notification from the Social Security Administration indicating what that IRMA value is, but also a person will receive instruction with regard to the appeal process. Decisions within the Medicare program can sometimes be appealed. This decision of IRMA is one of those. Basically, in that appeal process, you're asking Social Security Medicare to take a look at how your life is presently to determine if that IRMA can be reduced or eliminated. Now, beyond the premium, Medicare Part B does have its own deductible. It's a one-time annual deductible of $240. Once that deductible has been met, the individual does share their cost with the Medicare program at that 80-20 split. Medicare is responsible for the 80% portion. The individual is responsible for the 20% that's left over. Unfortunately, there is no maximum. There is no out-of-pocket limit on a person's 20%. That, of course, is where a person may consider a Medicare supplement to help with this particular cost. Onto the topic of enrollment, there certainly is a lot of confusion surrounding this topic. So let's first start with the situation of an individual who is automatically enrolled into Medicare. Now, automatic enrollment only occurs if an individual is getting retirement or disability benefits from Social Security or the Railroad Retirement Board. So in this situation of receiving benefits, a person is automatically enrolled into both Part A and Part B and would receive their red, white, and blue Medicare card typically 2 or 3 months prior to their Medicare eligibility. Now, in the event that a person is not receiving Social Security or Railroad Retirement benefits and they want Medicare to be in place, they will need to sign up themselves. The first opportunity to sign up for Medicare is provided through the initial enrollment period. The initial enrollment period is a 7-month window that surrounds either the 65th birth month or that month of eligibility if eligible based on disability. So in the case of a person turning 65, certainly a person can enroll into their Medicare 3 months before turning 65 and within those 3 months after turning age 65. In order to do so, Social Security Administration is the office that will need to be reached. Now, a person can certainly reach out to their local Social Security Administration, which may expedite the process. The information shown on the slide today is the phone number for the National Social Security. Definitely, again, local offices may yield less waiting time. Social Security's website, though, is definitely an option to use in the enrollment into the Medicare Part A and or Part B. The process on Social Security's website, you will need to have a My Social Security account prior to doing the Medicare application. So a person would want to make sure to have their Social Security account established on the socialsecurity.gov website first before initiating the enrollment. Now, what if a person has access to insurance, whether it's from their own active employment or perhaps it's insurance available through their spouse's active employment? Because of the misinformation that surrounds this, I typically read this slide verbatim, at least the first portion. And as we see, it indicates that if you or your spouse are currently working and you receive your health care coverage from active employment, you are not required to enroll into Medicare at age 65. Now, let's elaborate on this. This particular rule is typically specific to what is considered a large employer, that employer that has more than 20 employees. In this event, the employer coverage, the group health insurance from the employment, is primary. It pays first, paying before Medicare. Now, in the event that a person has insurance in place from employment, but the employer is a small employer having less than 20 employees, enrollment into Medicare, both Part A and Part B, should be considered because the Medicare program is actually primary in this event of a small employer. Medicare pays first, the group health insurance pays second. So in order to ensure a person has appropriate coverage, in this situation, Medicare enrollment is most likely a step that will need to be taken. In the event that a person decides to defer enrollment into Medicare until a later date, perhaps working until, say, for example, age 68 or 69, at the time of retirement at that point, the individual will have what's known as a special enrollment period in order to elect Medicare benefits. Typically, a person is going to initiate enrollment into their Part A or Part B 2 months before they need it to begin, but they do have the option of enrollment up to 8 months after losing that group health insurance. In the event that a person misses enrollment at 65, that initial enrollment period, or they miss enrollment at retirement during the special enrollment period, the only other time enrollment into Part A or Part B can be done is during the general enrollment period, the first quarter of each year, January 1st through March 31st. In the event that a person enrolls during general enrollment, they would see coverage effective the first of the next month after enrollment. But this is where typically an individual may encounter penalties. And we do remind folks that Medicare penalties, unfortunately, are lifetime penalties. In order to avoid penalties, a person should consider enrollment into Medicare if they do not have access to insurance through active employment. This slide provides us a visual of that initial enrollment period leading into the special enrollment period available after the initial enrollment period ends in the event that a person has insurance in place from active employment. So in this example, we see the person turns 65 in the month of July, meaning that April 1st is that first opportunity to enroll into Medicare during the initial enrollment period. In the event that the person enrolls in either the month of April, May, or June, they would have their coverage effective July 1st. Of course, the individual has the opportunity to enroll into Medicare up to 3 months after. In this example, October would be that third month after turning 65. The special enrollment period, that opportunity of a continuous enrollment period, then begins on that fourth month, in this case, November 1st. Again, as long as an individual has insurance in place from active employment, that special enrollment period would be available to initiate Part A and Part B. The final point to make about Medicare Part B is the fact that there is an assistance program available for individuals who may have limited income or resources. The assistance program, known as the Medicare Savings Program, if qualified for, essentially pays the Medicare Part B premium for the individual. On the slide, we see the qualifying income and qualifying assets requirements in order to be able to have this program in place. The application process is handled by the Department of Health and Human Services, or applications can be done by contacting Access Nebraska at the number shown on the slide. We certainly do share this information because we want folks to be aware of the fact that assistance programs within Medicare do in fact exist. Next, we're going to address Medicare supplements, sometimes known as Medigap policies. Now, Medicare supplements are optional extra insurance. An individual is not required to purchase a Medicare supplement. If a person chooses to do so, they will be purchasing their supplement from a private insurance company. Note, of course, that Medicare supplements are standardized by Medicare, essentially ensuring that the coverage purchased is not modified. A supplement is a supplement, if you will. The other thing about Medicare supplements is the fact that they are guaranteed renewable, simply meaning as long as premium is paid, the policy is the individual's to use. With regard to what a Medicare supplement does, it is in place to address a person's out-of-pocket cost after Medicare Part A or Part B has paid first. So most notably, we're probably thinking about that 20% share left over after Part B has paid first. With regard to supplement options, Medicare supplement options definitely do exist. And the differences one would note is in the level of coverage that's being provided. So, first thing to note, don't confuse Medicare Supplement Plan A or Medicare Supplement Plan B or Plan D with Medicare's Part A or Part B or Part D. Medicare unfortunately created an alphabet soup here using an alphabet system for the supplements. Certainly, if a numerical system were used here, that would cut down on the confusion. But we have the system as it is in place. So just again, make sure to note, do not confuse Plan A, Part A, etc. Now, the matrix here is basically indicating the level of coverage that's available from a Medicare supplement. As I stated previously, Medicare supplements are standardized, and a part of that standardization means there are 6 basic required benefits. These first 6 line items above the black line in the middle are basic required benefits. We see Plan A addresses those basic required benefits. Below the dark line in the middle, these line items are extra benefits. We see Plan A addresses none of those, whereas we move down the line, Plan B does address the 6 basic required benefits, and one of the extras being the Part A deductible. So essentially what we're seeing from this matrix is that the Medicare supplements are the part of Medicare that you get to customize, if you will. You get to choose the level of coverage that's most appropriate for you, certainly noting that your out-of-pocket cost is going to be different based on decisions you make. A person who wants the basic coverage available is looking at a Plan A. An individual looking for the most comprehensive coverage is potentially looking at the Plan G. We see that the G does have 4 additional check marks for the 5 extra benefit line items. Certainly, we see consistently that the Part B deductible is a line item that is not covered by most of the options. Certainly, we see in these grayed out columns a Plan C and a Plan F. If a person is still eligible to purchase one of those plans do address the cost of the Part B deductible. Those folks who are eligible for a C or an F are those individuals who turned 65 prior to January 1st, 2020. Any person who turns 65 after this date, access to the C or the F is not there. So again, potentially the most comprehensive would be the G, but there are these other options that can be considered. Now, when it comes to cost of a Medicare supplement premium, in Nebraska, we definitely see a very wide range of premium, anywhere from $35 up to $640. Definitely something to really spend some time and research on, just to ensure that you are choosing the option that fits your needs the best. Now, when a person is looking at the cost of Medicare supplements, remember the standardization is in place, and that does typically require that a Plan A be offered by a company that wants to sell a Medicare supplement, and then they get to decide from there what's other options to offer. In this cost example, we are indicating that a Plan A offering the fewest benefits will potentially cost less than an option that has more benefits, in the example of Plan G. The second cost example is simply alluding to that standardization of the supplement. A person is not going to receive any additional benefit or any reduced benefit based on the premium they pay. In this example, Company Y and Company Z is offering a Plan G at 2 different premium values. The coverage being provided at those premium values is exactly the same. Remember, supplements are standardized. Now, when it comes to the enrollment into a Medicare supplement, it is definitely important to keep in mind the fact that there is a one-time guarantee issue period, or an Medigap open enrollment period. This is a 6-month window. It begins when the individual begins their Medicare Part B for the very first time at age 65 or older. Once that window of opportunity has begun, it has begun. It cannot be paused, reset, or refunded. Within the 6-month period, an individual is guaranteed the purchase of a Medicare supplement. Pre-existing or current conditions cannot be used to deny the policy. Now, after the 6-month guarantee issue or Medigap open enrollment, a person does have the opportunity to shop for a Medicare supplement at any point during a calendar year. The one thing to note, though, within that shopping experience, underwriting will be a factor. The individual will have to answer questions about health and history, and based on the answers, the insurance company will have the right to either offer or refuse a policy. If they offer a policy, they get to determine the premium for that policy. So we really do encourage folks to think of the Medigap open enrollments or that one-time guarantee issue as potentially being a lifetime decision, especially if a person has pre-existing or current conditions that underwriting may not be so forgiving to. So potentially the biggest point from this portion of Welcome to Medicare is the Medigap open enrollment. Again, a 6-month period that begins when Part B, medical insurance, begins at 65 or older. So the Nebraska SHIP office does provide resources for an individual to research their Medicare supplement or Medigap options. The resource provided through our office is available to anyone who wants it. In order to receive personalized information, an individual simply needs to provide their zip code, their age, their gender, their tobacco status, and which plan they're interested in, potentially that Plan G. From that, we will be able to provide a full listing of every option that is licensed to sell within the area. That listing includes not only the name of the company, but the premium advertised for them at that point. Definitely wonderful information that is available. All you need to do is ask. Our next topic is Medicare Part D, or prescription drug coverage. Medicare Part D prescription drug insurance was introduced in 2006. Prescription drug insurance exists to cover brand name and generic prescriptions. Options change from year to year. In Nebraska this year, we have 21 plans available for a person to enroll into. The monthly premiums do have a large range from the lowest premium to the highest premium in our state, a difference of $123 between those two options. Certainly, those individuals with a higher income, they may encounter an IRMA with this part of Medicare as well, Part D drug insurance. Remember that IRMA is based on the tax return from 2 years prior, and it is a decision that can be appealed. Outside of premiums, a person could encounter a deductible. Plans in Nebraska do range anywhere from a zero deductible up to the maximum of $545. Of course, when a person uses their prescription drug insurance, they may have a copay or a coinsurance responsibility when they pick their prescriptions up from the pharmacy. When a person is researching their Medicare Part D options, things to keep in mind is first, whether or not prescriptions are currently being taken. If so, the prescriptions in place really should be the driving force behind this decision of which Part D plan to enroll into. And the reason for that is because each of these prescription drug plans, they have a formulary, basically fancy word for drug list, And within that formulary, there is a tiering system. Tier 1, Tier 2 drugs are typically your generics, potentially having a copay value, whereas Tier 3, Tier 4, that is potentially your brand name tiers, where a co-insurance, a percentage of full cost, is seen as a responsibility for an individual. Beyond that, other things to keep in mind is the fact that prescription drug plans do have a network structure, meaning that there are differences in pharmacy participation. Some pharmacies may hold a status of preferred, typically providing the lowest cost available, whereas other pharmacies may simply be in network, meaning the insurance can be used there, but higher cost may be paid by the individual. Of course, out of network simply means the insurance does not work with that pharmacy, and the insurance would pay nothing if anything were obtained from an out of network pharmacy. So when a person again is looking at their Part D options, an existing drug list is the suggested guide in making that decision. If a person is a person who does not use prescriptions, then they may be looking at the premium and deductible. Certainly, that reminder, Medicare is individual insurance, especially when it comes to the Part D prescription drug side. So concerning the enrollment into Medicare Part D, we see on this slide essentially that theme that we saw with enrollment opportunities into Part A and Part B. Essentially within Medicare Part D, a person has that first opportunity to enroll into that coverage during their initial enrollment period. Definitely if a person is working beyond age 65 and Medicare eligibility from that point, the individual does have the opportunity to enroll during a special enrollment period at retirement, but certainly note that special enrollment periods can be created through other life-changing events. Certainly change of address would be one of those opportunities that could afford a person a special enrollment period to review options within the new area and elect an option that would fit their needs within that new area. To sign up, Medicare.gov is a wonderful resource. It is the official U.S. site for Medicare and does provide a plan finder tool that is certainly used by the staff and volunteers of Nebraska SHIP. So it is a wonderful, reliable tool that does provide quoting information with regard to what one could anticipate their prescription drug costs to be well covered under a prescription drug plan through Medicare. So Medicare.gov, Nebraska SHIP, other resources certainly do exist, but just keep those tools in mind. The final point regarding Medicare Part D prescription drug coverage is the fact that there is an assistance program available. This program is known as Extra Help, or LIS, Low Income Subsidy. This is a program administered by the Social Security Administration. An individual who qualifies for Extra Help is going to receive help regarding their prescription drug costs in the form of lowered premiums, lowered deductibles, lowered copays and coinsurance amounts when they do need to refill their prescriptions. On the slide, you do see that there are income and asset requirements in place for a person to qualify for the Extra Help program. Do note that the asset requirement, it does not include a person's home nor of their vehicle. The applications for Extra Help can be submitted through either the Social Security Administration, or you can contact the Nebraska SHIP office. We definitely do assist individuals in filling that application out. So when we are looking at the potential cost of original Medicare, a person will definitely see their individual cost reflect the decisions they make, especially if they do decide to purchase a Medicare supplement, and which supplement plan are they interested in purchasing? Are they going for a plan that offers a lower premium with a deductible responsibility, or are they opting to choose something with a little bit of a higher premium where there's no deductible to be met. Definitely Medicare Part D drug coverage, as we just reviewed, the premium of the plan is going to be most likely determined by a person's prescription drug list. So again, that message of Medicare is individual insurance. In this cost example, we see that a person should anticipate monthly premium costs to be roughly around $350 a month, based on decisions made regarding those variables of the supplement and the Part D prescription drug plan. Certainly, folks might see lower costs, again, based on those decisions made. An individual review is certainly encouraged and is something that can be provided through a one-on-one conversation with a Nebraska SHIP representative. Next, we are going to look at Medicare Advantage, also known as Medicare Part C. Medicare Advantage is the alternative to original Medicare. Medicare Advantage plans are managed by private insurance companies, and in order to enroll into Medicare Advantage, an individual must have both their Medicare Part A and Part B. Medicare Advantage plans are required to accept applications from any individual who has both A and B. There is no underwriting with regard to being able to join an Advantage plan. What the Advantage plan is required to do is to provide equal or better coverage than that provided by original Medicare's Part A and Part B. Typically, the extra coverage is coming from the inclusion of Medicare Part D prescription drug coverage within this package of Medicare Advantage. So, with regard to this, the Medicare Advantage plan also has the opportunity to provide additional extras. Notably, we see the inclusion of dental or vision or hearing as that most common extra, but other extras can exist. You've heard of gym memberships or potentially over-the-counter, or rather access to over-the-counter items. Many plans do provide a quarterly stipend towards being able to obtain OTC items, perhaps vitamins, minerals, things that aren't traditionally covered by the Medicare program. So those extras are nice, but certainly should not be the main reason for a person's enrollment into the Advantage plan, or at least not the main focus. When a person is evaluating Medicare Advantage, they really do want to make sure that they're taking into consideration all of the aspects of the Advantage plan. The other thing to keep in mind is the availability. Many counties, in fact, 92 of our 93 counties in Nebraska, they do have a Medicare Advantage plan option. Unfortunately, Cherry County is the only county in Nebraska without an Advantage plan option. Now, the cost structure of the Advantage plan is going to be unique to itself. Again, Medicare Part B is going to be required for a person to enroll, and certainly a person would still be responsible for that Medicare Part B premium. In addition to potentially an additional premium if an Advantage plan decides to charge an extra premium amount. You see in Nebraska, there are options that do charge potentially up to an extra $140 per month. Outside of the premiums, Medicare Advantage plans can potentially have a deductible regarding the health coverage side, and certainly potentially a deductible regarding the prescription drug coverage side if the Advantage plan provides that coverage. Definitely within the Advantage plan structure, copay and co-insurance is something to be aware of, especially considering the fact that Medicare Advantage is that pay-as-you-go structure. Example includes maybe a person has a $5 or $10 copay to see their primary physician. Maybe they have a $45 or $50 copay to see a specialist. Perhaps there's a copay range anywhere from from 0 to 500 to receive an outpatient service. Each plan is going to vary in that copay structure, and that is something that really does need to be evaluated to determine what is best for the individual, because again, it's the pay-as-you-go structure. There is no supplement option to assist with that out-of-pocket responsibility. Now, one thing to keep in mind with regard to the Advantage plan is that this is an option that does have a built-in out-of-pocket maximum. In Nebraska, that maximum sits anywhere between 2,500 up to 13,300. The maximum is going to be determined by that plan and is something that should be considered. So a person can understand what their potential out-of-pocket responsibility could be in the event of in the event of increased use or potentially maxing out that out-of-pocket max. The other factor to keep in mind when evaluating Medicare Advantage is the fact that the Medicare Advantage plan option is one that is structured as a network. Typically, HMOs and PPOs are going to be the most prevalent options in Nebraska, but there are other options available. A PFFS certainly does exist in western Nebraska. Cost plans also exist within our state. Cost plans are not Medicare Advantage plans, but they do get lumped into the Advantage plan arena based on the fact that there are some similarities. But cost plans are a unique product in itself, and if you have questions about that, I would encourage you to reach out to the Nebraska SHIP office to discuss that particular option a little more extensively. During this Welcome to Medicare class, we're just going to go ahead and kind of focus in on the HMO PPO because it is the most prevalent. So basic difference between HMO PPO, HMO Health Maintenance Organization is that structure of having a network in which a person is required to use that network in order for the insurance to pay appropriately. Any services received outside of an HMO's network is most likely going to see an individual be 100% responsible for the cost of those services received out of the network. The PPO, the Preferred Provider Organization, is a structure that has a network of providers, and if an individual is able to use that network, they will typically experience lower cost, lower copays, lower limits on spending. But the one nice thing about a PPO, of course, is the fact that it does provide access to out-of-network coverage in the event that a out-of-network provider or hospital is willing to accept the insurance as an out-of-network provider. In the event that a person goes outside of a PPO's network, the individual is probably going to be responsible for maybe 50% of cost, if not less, depending on the chosen plan that they've enrolled into. So the network is certainly something that an individual needs to be aware of. Where can I use this insurance locally? If I'm traveling, am I able to use it outside of my regular regional area? The other thing to note about Advantage plans is the fact that many plans do have a prior authorization requirement, simply meaning the need to ask permission, if you will, prior to receiving a service or item. A person who receives a service or item that has prior authorization and doesn't receive said authorization may potentially be fully responsible for any service or item received if no authorization was requested or provided. So definitely a viable option. It's just an option that an individual needs to be more aware of in their use of their insurance. Regarding enrollment into Medicare Advantage, the same opportunities exist essentially for this option. We do see the first opportunity to enroll is during the initial enrollment period. If a person works beyond age 65, they do have that special enrollment period available at retirement. But special enrollment periods can be created through other life-changing events within this part of Medicare as well. Um, to sign up, Medicare.gov, as mentioned previously, is that official U.S. site for Medicare and is a wonderful resource to evaluate Medicare Advantage plan options. The Nebraska SHIP office is available to provide education, but other resources do exist. Certainly, conversations with local agents are encouraged, since those individuals do work with the product and are able to address the common questions that they may have within the individual area. So again, the point of Medicare is individual insurance. You definitely do want to take the opportunity to evaluate your options and really make a good decision regarding the option that you will run with when you decide it is time to fully enroll into the Medicare program. So the potential cost of Medicare Advantage, as far as premiums, we do see on this slide that one could anticipate a lower out-of-pocket responsibility regarding premiums versus that of the original Medicare structure. Enrollment into both Part A and Part B, again, is necessary. Continuing to pay the Part B premium, that responsibility still exists, and certainly if a plan decides to charge an additional premium, they may, but many plans in our state do offer rather a zero additional premium. So when looking at these differences between original Medicare and Medicare Advantage, premium cost is half the conversation. Usage does need to be considered as well. Potentially an individual who has a lower use of their health insurance, that individual may potentially find Medicare Advantage to be a cost-effective option in the sense that they're saving money through lower premiums, only paying for services as they're received. Whereas an individual who potentially has a higher use of their insurance, that individual may find the original Medicare structure to be more cost-effective. Certainly, that original Medicare structure does have that need of addressing premiums up front, but as we saw, generally after meeting the Part B deductible, the out-of-pocket responsibility is then addressed by the Medicare supplement rather than the individual. So both options are viable. Enrollment in the U.S. at this point is essentially 50-50 between original Medicare and Medicare Advantage. So that's why, again, that message of Medicare is individual insurance, and you really should do an individual evaluation to determine what is best for your individual needs. Our final topic is addressing Medicare fraud and abuse. One of the major points to indicate within this topic of fraud and abuse is the annual estimate that Medicare has regarding the potential loss due to fraud and abuse, and that estimate unfortunately sits between 60 billion up to 100 billion dollars each year. I believe this initial estimate was first made in 2014 and unfortunately has been a consistent estimate of loss each year since. Definitely fraud and abuse within the Medicare program. It does have a potential impact to affect the program in the sense that will premiums or deductibles be affected by financial loss due to fraud and abuse? Will Medicare need to look at the benefits that are provided due to potential budgetary restraints. So definitely, we do encourage folks to really take a hand in protecting their Medicare benefits. Definitely, it's important, and certainly human error is a factor. You know, not every instance of incorrect billing is a matter of fraud or abuse. Human error does exist. That's why we really do encourage folks to really take the opportunity to review and investigate if they do suspect potential Medicare fraud, error, or abuse. So, what can a person do to protect their Medicare? From the Nebraska SHIP and the SMP, we do ask individuals to consider these three things, and that is, of course, to first prevent, second, detect, and third, to report. When we talk about prevention, we really do reinforce that message that Medicare is a government entity, a government office. Medicare does not call individuals as a cold call. You're not going to receive a phone call from a person at Medicare asking to verify your personal information. Phone calls like that do exist in our state and throughout the entire country. And unfortunately, those are fraudulent phone calls that many individuals do fall for. These scammers are very good at what they do, and they're able to really create comfort and get the information out of a person. So definitely just remember, when a person's calling and saying that they represent Medicare, that is most likely a fraudulent phone call. The only time Medicare would reach out to a person is in the event that the individual is being asked to participate in a Medicare survey. But one thing to note about that survey is Medicare will generally send the individual a notice through the post office, a letter that basically says, we would like you to participate in this survey. We would like to call you out this date and this time, basically giving the individual a heads up that they do want to have contact. So certainly, again, prevents potential Medicare fraud and abuse by protecting personal information. Outside of that, when we talk about detection, remember that Medicare does provide a Medicare summary notice when a person uses their Part A hospital or their Part B medical insurance. The individual who uses their Part D or their Medicare supplement, or if enrolled in Medicare Advantage, an individual who uses those insurance options would receive an explanation of benefits. These resources are sent, and we encourage folks to keep records, perhaps a healthcare journal that can be compared to the MSN or the EOB to basically look for potential flags. You're probably looking for billing for a service twice, billing for a service not received, billing from a doctor that you are unaware of. Definitely ask questions, report it. Perhaps a conversation with the provider's office is necessary, may result in determining human error. But certainly, if there is that suspicion that activity is in fact potentially Medicare fraud or abuse, reporting can be done through the Nebraska SHIP. As stated at the beginning of the Welcome to Medicare class, the Nebraska SHIP does also serve as the state SMP, Senior Medicare Patrol. And we do have that ability to help get information into the appropriate hands to determine whether or not Medicare fraud or abuse does in fact exist. Finally, we will conclude with a recap of what Nebraska SHIP and SMP can provide. Just remember that there is this office that does provide local help for Nebraskans with Medicare, providing unbiased education and support. Certainly, one-on-one conversations can be scheduled to discuss original Medicare options, Part D supplements, a conversation about Medicare Advantage or Part C is definitely available. And note that we are available to provide education to groups. And if anyone is interested in any services provided by the Nebraska SHIP or the SMP, you are welcome to reach out to our toll-free hotline. This hotline will provide the opportunity to connect with the office nearest you. But again, that reminder that our website does also provide some great information. So I thank you for your time in viewing this Welcome to Medicare class presentation. And again, just if you have questions, feel free to reach out. I appreciate your time. Thank you.